Hi everybody, and thank you very much for coming to this webinar. It's really exciting that you feel able to attend, because it is a time of huge uncertainty and a lot of questions will be coming up about donation, about whether you should do this, about how your recipients might be feeling, about any expenses that you might be needing along the way. So this is a point of trying to make it clear for you what to expect, what's actually going on at the forefront. And we've got some great people here who's also able to help with your questions. We've got Caroline, who is the CEO of Fertility, who is going to be there to answer any seriously important questions. We've got Mara, who's fantastic. She's our CMO, the doctor, and she'll be able to answer your medical questions. And we've got Julia, who's in charge of communications and has got me set up for the first time on a webinar. So welcome everybody, and it's really good to be able to talk to you.
So I'll say also a very warm welcome to everyone joining us today. A very quick note on how you can ask questions. There's a chat feature. If you hover over the bottom of your screen and you click on it, you can ask questions that way, both privately or publicly to the room, and we'll pick them up. So I'll pass over to Caroline.
Yeah, hi. So I'm Caroline. I'm the CEO of Fertility, and I wanted to give you a huge thanks for what you're doing for your recipients. First, I think it's amazing, and especially at that time. I wanted also to tell you that in these uncertain times, some things are positive, such as, of course, the pollution diminishing in China, but also the fact that at Fertility we have seen that being a virtual clinic, we've been able to have to turn around fast, and everyone is working from home. So we were able to make sure that everyone is safe, and we continue to operate. We are there for you from 7 a.m. till 9 p.m. every day, every weekday. And we can be also there for you during the weekends from 9 a.m. to 1 p.m. So on top of Altri advisors, you can also contact our Fertility advisors and have diagnostics, consultation, etc. with the medical team and the support team.
Great. Thank you so much, Caroline. So I'll hand over to Alison with the first question, which is, what is the impact of coronavirus on fertility treatment?
Well, the coronavirus is, as you all know, we're really uncertain with it all, but it seems like at the moment, the position is that if you are thinking about being donor, the very beginning part of this we can all do. It's virtual, we can manage things as we always have done. But once we start getting into the clinical treatment cycles, we will be advising donors to contact their clinics. If they're independent, contact their advisors, because the situation is changing by the day, and it may be that you really shouldn't be starting a treatment cycle. That is what I think, Mara, you're recommending at this stage. Yes. So it's much better that you just hold and wait in this uncertain time, because it will settle. We will be able to take you through as soon as we possibly can, but really not starting treatment right now is probably not the best thing to be doing.
And just to clarify, Alison, when you say starting treatment, as a donor, can you tell me which part I could go up to? Can I still express my interest to be a donor, for example? Definitely.
Really keen to have anybody listening to this, to be a donor. Gosh, we need people, particularly now. It's such a great thing to be doing when it's a time of uncertainty, when people are really feeling worried and down and low, but to be a donor is fabulous. And you can start with Altri. We will talk you through the process. We'll take a bit of time. We're here for you now, and the time is what we've got. And we will explain exactly what's involved. And then when you're ready and you feel that this is something you'd like to do, we can start off the preliminaries. And that will be about seeing whether or not you can be a donor, which is where the medical side of things come on board. And Mara will be able to talk you through perhaps just a little bit of the initial stages of the process, because that is going to take time anyway. And then once you've got through that, you'll be in a position to start a treatment cycle, which is when you actually do that 2-week window of egg donation.
Fantastic. Thank you so much. And for donors who have appointments this week, I'm not sure where people are in their journey, but what happens if someone does have an appointment this week?
If someone has an appointment this week in clinic, it's really advisable to talk to one of your advisors. The Apricity advisors are brilliant. They're there for you the whole time. The Altrui advisors are as well. They will have detailed information from your particular clinic about any appointments, so whether they need to be rescheduled, whether perhaps you just wait a little bit longer to go in for that appointment. But the key thing is to just ask any one of us. We're all here for you, and we will be advising you because the situation is changing by the day, as you probably know.
Great. So you mentioned Apricity advisors. Maybe Caroline, you could shed some light on who they are, and also when they're open, in case some of the donors in the initial part haven't met them yet.
Yeah, of course. So we have an amazing team of advisors who are there to support, of course, our patients, including donors. And they are there to coordinate the journey, to answer your questions, to hold your hand, so to say, during the journey. And they're available from 7 a.m. till 9 p.m. during weekdays, and from 9 a.m. to 1 p.m. during the weekends. We also have a medical team, and Mara and her team to do consultations and to supervise your treatment with partner clinics. Maybe Mara, you want to complement on that?
Yes, so as we said, so at the moment, what we could be doing for newly matched donors after Alison has done her fantastic work is we could be offering initial consultations, which would be virtual. We could also be offering implications counseling, again, virtual. And we could do any blood test that can be done via the so-called tiny kits, which is the kits that we send to you at home, and then you can post them. And obviously, since these are all done without you physically having to attend a clinic, these are still possible.
And the idea there is to be able to resume as fast as we can when the situation has settled. So the idea is really to do the preparation so that when it's possible again, that you can start.
Great. So if I am a donor that has actually just been referred in, and Alison, maybe you can explain what that means. How long will it be before I donate? Do we have any idea?
When we've matched you here at Altrui, and we've got you a recipient who we feel you'd really like, and and you know you're really happy about going ahead, I do what I call a referral, which means that your details will be sent to Apricity or a clinic, and they will then pick up the baton, as it were. They will contact you, and you will have an advisor to look after you going through, and they will then start the process getting you ready to be a donor. And this is the bit that will take a bit of time anyway. So by the time you've got to that, we're hoping that everything will be settled and you can start the treatment.
Okay. And perhaps a dreaded question, what if I get coronavirus? Will I be able to donate after that? What happens?
So perhaps I can answer this one. So at the moment, the advice is that 28 days after someone has shown no more symptoms of the condition and have fully recovered, that it will still be possible to consider a donation. With coronavirus, the medical facts keep coming in every day. And of course, a guidance gets updated, but that's what we know currently.
Can I ask you, Mara, because some of the donors might ask, might the coronavirus sort of in any way affect their fertility? And should they, you know, if, for instance, they're, you know, inadvertently pregnant by, you know, what happens then?
Sure, that's a good question. So this coronavirus is a new strain. So we don't know everything about this particular virus. We have some information about pregnancy in the later stages from cases in China where women at the later stages of pregnancy were infected. All cases had a good recovery, and both mothers and babies were fine. Some needed to be delivered earlier because of the effect of the disease. we're not entirely sure, of course, about what it could do in early pregnancy, but at the moment there is no strong indication that it could affect the early stages of pregnancy. So what we also know at the moment is that pregnant women are not the risk factor groups, which means that they're not more likely to get the coronavirus or less likely to recover from it. But of course, we do advise anyone who's pregnant to be extra careful and to be within the so-called protected groups.
Great. And I saw that some donors were actually asking about their recipient, and I'm sure they'd love to know how they're feeling and if we're in touch with them.
Yes, a number of donors are wanting to know about the couple or the person they're due to help, and we can give them so much information. I mean, naturally, it's such a, we've said, it's a worrying time. So it's really fantastic if, I mean, a lot of you, you've all reassured us that you feel okay about continuing the process, which is just incredible. And we've passed that information back, so it's caused such a sense of relief. You've got no idea how somebody just said, oh, this is just amazing of her. We're just so thrilled she'll stay there. So thank you very much for sticking in there.
And do the recipients have contact with your team on a regular basis? You know, are they supported?
Definitely with Fertility and Fertility, all the advisors are there the whole time. So they do get a lot of support, as do the donors. And it's the whole premise of the companies. It's about being there for them the whole time so that they don't feel unsupported in this journey.
Great.
Maybe what we can add is that on top of being in touch with recipients on a daily basis with our advisors, we have also organized such a webinar for them, for our patients yesterday actually. And we had a lot of questions because what you must know is that for recipients, they have had a very long fertility journey. It's something that's so important for them. So they are really worried that this is adding again another moments of stress, of waiting, and etc. So that was really reassuring, as Alison mentioned, to tell them about you being there for them. So thank you again for that.
So I think we're going to be closing up soon, but I did see that someone just joined, so maybe we can give a quick roundup of the services that we have available. So at what point can we still be helping donors through their journey? When do they have to stop, and how they can get in touch with us, and at what times?
So perhaps it makes sense that I start, because the journey starts with Fertility. The first thing you need to do is to call in, and we'll talk you through the whole process. We'll find you someone who we feel that you would really like to help. And then when you're happy to go ahead, I then refer you into Fertility, and it then is picked up by the advisors at Fertility and the medical team.
And at Fertility, so I mentioned we continue to function, of course. Our advisors are available from 7 a.m. till 9 p.m. during weekdays, and from 9 a.m. till 1 p.m. During weekends. We can also continue to actually do the diagnostic part. We can continue to have blood tests when they are done at home. We interact with partner clinics on a daily basis also to see if it's possible to have scans with them, but we don't start any treatment for the moment. The idea is to actually resume when the situation has settled. Maybe Mara, you want to complement?
It's all of these things, Caroline, and like we said, we're happy to do as much as possible. We haven't been affected as a Fertility ourselves in our internal processes and our initial appointments, because we've been a virtual clinic in any case, and we will be preparing people up to the point we can, so that when the situation settles, we can resume from where we left it.
Great. So in a moment, I'm going to hand over to Alison for a little goodbye, but I'll just recap by saying that we are open. We are running as close to usual as we can. For anyone who's interested in exploring donation, we would love to hear from you. And such a big thank you to the donors who have shown resilience through this time and interest, and it's meant a lot. And if you have any other questions that were not answered in this webinar, please don't hesitate to get in touch with us at any time. So the numbers are on both the Altrui and Apricity websites. And without further ado, I'll hand over to Alison to say goodbye.
I think Julia's really said it. It's just a huge thank you, and it's a fantastic time for you guys to be thinking about doing this and to be going through a process when I know there's a lot of uncertainty and there's a lot of challenges for each one of you. But we're here, the whole teams are here to support you and guide you through this, and we would really love it if you can come on board and just help make the world a little bit of a better place and a bit more positivity at the moment. And so thanks guys so much.
Thank you.
Thank you.